Physiology SAQ 7 Distribution of blood flow. A. Outline the distribution of cardiac output in terms of proportion to the main organs. 2 marks. Tissue blood flow. To the brain, 15% of cardiac output or 750 mL per minute. Liver, 29% of cardiac output or 1.4 liters per minute. Kidneys, 20% of cardiac output or 1 liter per minute. Heart, 5% of cardiac output or 225 mL per minute. Skeletal muscle at rest, 15% of cardiac output or 750 mL per minute. Skin, 8% of cardiac output or 400 mL per minute. Other tissues, 8% of cardiac output or 425 mL per minute, totaling to 5 liters per minute. Note, different textbooks have different quotations. Additional information. Changes in cardiac output during exercise. For the brain at rest, it is 750 mL per minute and doesn't change with different degrees of exercise. Coronary blood flow at rest is 250 mL per minute and can increase to 1 liter per minute during heavy exercise. Renal blood flow is 1100 mL per minute at rest and decreases to 250 mL per minute during heavy exercise. Splanchnic blood flow is 1.4 liters per minute and decreases to 300 mL per minute during heavy exercise. Skeletal muscle blood flow at rest is 1.2 liters per minute, which increases to 22,000 mL per minute during heavy exercise. Total cardiac output is 5.8 liters per minute, which increases to 25 liters per minute during heavy exercise. B. Describe how various physiological factors affect this distribution. 6 marks. The physiological factors affecting the distribution of blood flow to the main organs is influenced by the factors described by the Poisson-Hagen formula. Q equals delta P pi r to the power of 4 divided by 8 viscosity times length of vessel. Delta P is the pressure difference, r is the radius of the vessel, Q is blood flow. Driving pressure, radius of blood vessel, viscosity of blood, length of blood vessels, compliance of blood vessels and volume of blood affects the distribution of blood flow. Driving pressure, i.e. cardiac output. Cardiac output equals heart rate times stroke volume. Any factor that causes cardiac output to increase by elevating heart rate or stroke volume or both will elevate blood pressure and promote blood flow. Examples of these factors include sympathetic stimulation, catecholamines such as adrenaline or noradrenaline, positive inotropes or chronotropes, thyroid hormones, fluid boluses, and increased calcium ion levels. Conversely, any factor that decreases cardiac output by decreasing heart rate or stroke volume or both will decrease arterial blood pressure and blood flow. Examples of these factors include parasympathetic stimulation, shock, hypoxia, hypocalcemia, and acidosis. Radius of blood vessels. When the radius of blood vessels decreases, resistance increases dramatically and flow decreases. A slight increase or decrease in diameter causes a huge decrease or increase in resistance. This is because resistance is inversely proportional to the radius of the blood vessel raised to the 4th power. This means, for example, if an artery or arteriole constricts to 1/2 of its original radius, the resistance to flow will increase by 16 times. Causes of reduced radius of blood vessels includes vasoconstriction, atherosclerosis, and vasocompression. When the radius of blood vessels increase, resistance decreases and flow increases. Causes of increased radius of blood vessels includes vasodilation, hypervolemia, and post-balloon angioplasty. Viscosity of blood. Viscosity describes the frictional forces which act between the layers of the fluid as it moves down a tube. The viscosity of blood is directly proportional to the resistance and inversely proportional to the flow. Therefore, any condition that causes viscosity to increase will also increase resistance and decrease flow. Conversely, any condition that causes viscosity to decrease will decrease resistance and increase flow. Two primary determinants of blood viscosity are the formed elements and plasma proteins. Examples of conditions that increase blood viscosity includes polycythemia, leukocytosis, thrombocytosis, and hypothermia. Examples of causes of reduced viscosity includes anemia and reduced plasma proteins, for example due to reduced liver production or leakage, for example due to nephropathy. Length of blood vessels. The length of a vessel is directly proportional to its resistance. The longer the vessel, the greater the resistance and the lower the flow. Examples of conditions where length of blood vessels increase includes weight gain or tumor formation. Likewise, if the vessel is shortened, the resistance will decrease and flow will increase. Examples of conditions where length of blood vessels decrease includes weight loss and amputation. Compliance of blood vessels. Compliance is the ability of any compartment to expand to accommodate increase in content, i.e. increase in volume of a vessel produced by an increase in intravascular pressure. The greater the compliance of an artery, the more effectively it is able to expand to accommodate surges in blood flow without increased resistance or blood pressure. Veins are more compliant than arteries and can expand to hold more blood. When vascular diseases causes stiffening of arteries, compliance is reduced and resistance to blood flow is increased. The result is more turbulence, higher pressure within the vessel, reduced blood flow and increased workload for the heart. Volume of blood. As blood volume decreases, pressure and flow decrease. Examples of causes of reduced blood volume includes bleeding, dehydration, GI losses and severe burns. As blood volume increases, pressure and flow increase. Examples of causes of increased blood volume includes heart failure, renal failure, liver failure, and glucocorticoids. C. How is the distribution modified during hypoxia? 2 marks. In hypoxia, there is increased sympathetic discharge causing preferential distribution of blood flow to vital organs such as the brain, heart, respiratory muscles, and liver. Blood flow to the GI tract, spleen, pancreas, skin, fat, and limbs are decreased due to vasoconstriction.